let's go to someone from the private sector, either Dr. Nedelman. Could you talk a little bit about your vision for the Ohio Valley Medical Center and how you've been working in collaboration with the local officials to make that happen?
Sure.
And what you see as the impact on the community.
Borrow your CV someday for my next talk. But I think more than just the Ohio Valley. Can you hear me without the microphone? Well, more than just the Ohio Valley Medical Center, I think the overall importance of a strong healthcare delivery system for a community is extremely vital for attracting people to the community and having a sense of pride in the community. I think we look at school systems, we look at education systems, businesses, but also where can we go if we're ill or if we need to get good health care. And I think that we're accomplishing that here in Springfield, not only with our venture, the Ohio Valley Medical Center, but also with the Springfield Regional Medical Center. You can't help, and I grew up in this town, as many of us did, you can't help but look downtown and look at what's happened and what's being constructed. As far as our project, the Ohio Valley Medical Center, if I look back now 2.5 years, there was some debate initially about whether or not this should be built on a greenfield site in the periphery of Springfield. And I think if you look at what's happening nationally, most expansions of hospital systems are not going to downtowns, they're going to greenfield sites on the perimeters of communities and cities. We were sensitive, when I say we, this was the 36 physician investors, to what this community felt was very important for the vision of Springfield. Of course there was political pressure, but also we still had the opportunity to make choices. We felt that it was important to support our community and to invest in the downtown project. This was about 2 years ago. I can clearly remember the one meeting we had with all the physicians in the room and taking a hands-up vote. Where should we go to build? Not one physician dissented from going to downtown Springfield. We felt it was important for us to pay taxes. We felt it was important for us to invest in the community, not only from the standpoint of our own profitability, but for the things that we're going to expand from our project. We're excited about it. I think we can all drive down and see the building coming to fruition. We're also excited about the Springfield Regional Medical Center new building, and I think there have been extreme strides in improving the quality of healthcare delivery at our hospital. I think Mr. Weiner needs some credit for that. The hospital has just undergone an intensive 6-day survey from the Ohio Department of Health, and not one clinical deficiency was found at our hospital here in town. That is extraordinary. So we're making great strides on our own private investment to provide a small area of healthcare delivery which is run by physicians. We're working cooperatively with the hospital and Mr. Weiner, and we're very excited about the future for healthcare delivery in Springfield.
I just want to say one word in connection with that. Obviously the city worked hard and were fairly tough about getting them to come downtown. But the other piece of that was what were they going to build? And the initial plans were something that looked like a suburban area. And we said, well, that doesn't fit with what we're trying to do downtown. And I want to thank the local doctors who I think were the ones who said, we want to be a part of this community. So we want to build a building that belongs in the plan for what building's going to look like downtown. And I think what we see emerging is exactly what we had in mind. And I just want to, on behalf of the community, thank you for making that decision.